The country is facing a stockout of COVID-19 vaccines to issue as second doses to healthcare workers, among other frontline workers. This comes after a number of medical practitioners complained about missing their second jab, despite being alerted to get it in various facilities. As our very own Raquel Muigai reports, the Ministry of Health is asking for patience as they await 350,000 doses to arrive in the country from Denmark. Take a listen.
Barely 3 weeks since the country began its second dose vaccination schedule, and the supply seems to have run dry. The Kenya Medical Practitioners, Pharmacists and Dentists Union raising their alarm.
Most of them have been going to the centers where they were supposed to receive this particular vaccine after receiving the texts. But the institutions do not have those COVID vaccines.
One of the doctors we spoke to after missing a second dose at Gov't Hospital narrated their experience. I woke up early and by 8:30 I was there. The nurse in charge said she had already issued the 350 doses. I proceeded to Afya Annex Naskop, where I was told to go back on Monday for the jab, as there was a list of those to be vaccinated.
The government has a lot of institutional history and capacity to do good vaccinations. And so this is something it is really within their wheelhouse to be able to roll out the second dose, just as they did with the first one, to make sure that every healthcare worker, essential worker, and everybody they've prioritized in the first dose can at least get the second dose.
On Twitter, such tweets reading of disappointment from a section of Kenyans were evident, a majority of those affected being those who were scheduled to take the jab from Gov't Hospital. Those we spoke to from the hospital saying queues of people waiting to get the jab can be seen from as early as 5 a.m. The Ministry of Health acknowledges the challenge but does not indicate when exactly the doses will be available.
Most important thing is to budget for the vaccine so that they can be bought. Because in the previous days, we've been depending on the donation of the vaccine.
That is why we want to promote local manufacturing of everything, be it vaccines, be it pharmaceuticals, be it non-pharmaceuticals.
At a time when certain areas in the country are recording an increase in the number of COVID-19 infections, coupled up with the presence of the Delta variant, the shortage of doses is indeed a concern. And while Kenya is not the only country undergoing this challenge, the Ministry of Health reassures Kenyans that those due for the second dose will get them once they are available in the country. Meanwhile, the national government is finalizing its plans regarding what measures to take to contain the spread of the virus in the Lake Basin region.
It's now becoming absolutely necessary. It may lead to us introducing new measures to deal with movement and some of the social activities.
In Nyandarua County, Uhuru Primary School has been closed indefinitely after 16 pupils and 4 teachers tested positive for the virus.
We would like to tell our parents in this school and the neighboring schools of Mandaraka and the area of Nyairoko and basically Orojorok sub-county is not to panic.
Over 1 million people have received a jab of the COVID-19 vaccine, 164,561 among them having received the second dose. 485 new infections were recorded out of a sample size of 5,355 in the last 24 hours, yielding a 9.1% positivity rate and raising the total number of infections in the country since March last year to 176,622. Raquel Muigai, Citizen TV.